We are healthcare experts who have been following the coronavirus outbreak globally. Ask us anything about COVID-19. Edit. We are signing off. Thank you all for all of your truly great questions. Sorry we couldn't get to them all. Hi Reddit. Here's who we have answering questions about COVID-19 today. Dr. Eric Rubin is editor-in-chief of the New England Journal of Medicine, associate physician specializing in infectious disease at Brigham and Women's Hospital, and runs research projects in the immunology and infectious diseases departments at the Harvard T.H. Chan School of Public Health. Nancy Lappert is editor-in-charge for Reuters Health. Christine Soers is medical news editor at Reuters. Hazel Baker is head of UGC at Reuters News Agency, currently overseeing our social media fact-checking initiative. Please note that we are unable to answer individual medical questions. Please reach out to your healthcare provider with any personal health concerns. Are you concerned about contracting coronavirus yourself? How safe do hospital workers feel caring for the patients? Am I worried myself? Yes. But I'm a doctor and patients need care, that's part of the job. Eric. You are very brave. I don't think I'd be capable of that. Thank you for everything that you are doing. Fucking heroes. Obligatory, not a doctor. Just a healthcare worker in direct patient care. I wouldn't consider any of us heroes. It's just the job we signed up for. Well, firefighters just signed up to be firefighters, but they are still heroes. You can quit any time and change careers. As an accountant, I'm at a very low risk other than the fact that the stress of my job leads it to have a much lower life expectancy than you'd expect. Now, I'm not hero. No one bleeding out on the ground's last thought is, I need an audit. For an accountant you're very funny though, so you got that going for you. I find accountants/analysts/finance people in general are typically a hoot. The stereotype suggests otherwise, but the ones I work with gotta keep things interesting in what can be a tedious, straining environment. What percentage of the population do you think will eventually catch COVID-19? Most epidemic modeling suggests that up to a third of the population may be infected in a first pandemic wave, with no interventions, so it all depends on human actions. Christine. I heard the Spanish flu hit so hard that to ed time around because it mutated enough to affect people for a to ed time who now had a weakened immune system. Is this possible? Edit. Weakened. I'm obviously not one of the AMAs, but I'm a physician and can answer your question with some biologic reasoning based on the information we know about COVID-19. More appropriately named as SARS-CoV-2, COVID-19 appears to have a low mutation rate, 8.68 *10-4. Substitution/side/year in a genome size of 30k. So this means the virus mutates on an average of 1 nucleotide/week, multiply substitution rate by genome size, and divide by 52 weeks in a year. There is an average of 4 to 10 nucleotide dissimilarity when comparing viral genomes from Wuhan, China to New York City. Based on this, for COVID-19 to mutate sufficiently to change mutagenicity of major surface proteins is exceedingly unlikely in the time frame of a few years. This means that developing a vaccine is technically feasible with our currently technology. The methodology to rapidly develop a vaccination entails making mRNA vaccine. This does not preclude a second wave occurring from infection of people not previously infected and who are currently in areas that have not been hard hit yet by the virus before herd immunity is reached either by recovery from infection or sufficient vaccination. Edit. Should also add, based on the mutation rate, it's unlikely for someone previously infected to become reinfected with the COVID-19 again within the time frame of a few years. Serology, blood antibody tests are being developed to identify patients who have been infected and recovered to the point we can definitely say they are immune. I've read that people can get it a second time, but glad to hear from someone that knows what they are talking about, that you likely won't. What you've read is wrong. Early on in the outbreak there were reports of reinfections that are entirely attributable to faulty test kits, or simply not having actually recovered from the virus. The fact one can recover from the virus tells us immunity is achievable. The thing we don't know is how long that immunity lasts. It could be as little as 6 months. It could be for life. To concerns. Do I need to sanitize food packages or mail parcels that I get from the delivery guy? How long does the virus stay on surfaces? And some countries are comparing the doubling of infection rate to Italy, which is scary. What is the likelihood of other countries going in this direction? To your first question, we don't know how much of a risk these represent. Yes, the virus can persist on surfaces. But epidemiologic observations don't really suggest that these are important sources of infection. If you're concerned, there are several online sources recommending how to do safe disinfection. For what it's worth, I don't bother. But the rest of my family does. Eric. The host says this is not needed. There has to be a better source than a 60s British rock band. Underrated comment right there. It's pretty appropriately rated. If you were to show symptoms of the virus, what is the best protocol to seek medical treatment without putting anyone else, including healthcare workers, at risk of exposure? Increasingly, areas with a lot of disease are setting up drive-through testing centers. There's one in my suburb where people can be tested without getting out of the car. If you have access to one of these, it would be ideal. Of course, it all depends on the availability of testing. That will improve, but still might be constrained where you are. Eric. No one is getting results for more days than it takes to recover though. Friend was tested because husband is immunocompromised and she was sick. That was 8 days ago and she still hasn't heard anything. My aunt had a fever and could barely function. She finally got tested and they just keep saying 5 more days. It's been almost 10 already. She's already recovered. When she does get her results, she can donate plasma soon, which is being used to help newer and more severe infections fight it. If she calls the Red Cross, they'll tell her 14 days from initial symptoms, and then they tack on another 14 for safety. My aunt tested positive, and it took just under 4 days. Maybe they don't hurry and send the results if your test is negative. Well, turnaround time is typically 12 to 24 hours. The wait is strictly the sheer volume of specimens the labs are receiving. Positive SARS-CoV-2 are called immediately to the doctors once resulted. And negatives that were tested routine are given when doctor office is open. And negatives that are stat are given to the DR 24/7, unless doctor requests not to be paged after hours or something. Inpatient get called for positives, and I think negative stats, but nurses be hawking for those results every 5 seconds. For good reason. Works in a medical lab. In other words, the longer it takes to hear back, the more likely it's negative? Depends. Most specimens my lab has sent for testing have been back in a couple of days. One went out to California and it's been 9 days with no results yet. What techniques are you applying on your personal lives to keep you going during these tough times? Another technique. Use your non-dominant hand to open doors. Take groceries off shelves in stores, etc. Because you are less likely to touch your face with that non-dominant hand. Nancy. That's such a simple thing that I've never even thought of. Thank you. I'm not a healthcare worker, but I've been doing this for the past month. I also started using my lesser used fingers, pinky and ring finger, whenever possible to do tasks. I like using a knuckle for buttons. I pretty much never touch my face with my ring finger knuckle. I've always done this. Especially at communal food gatherings. 50 people touch the serving spoon. I'm not putting their dirty hands in my mouth too. Ah, the life of a germaphobe. Also, a lot of door handles show wear patterns, where people tend to touch them. Don't touch door handles there. What do you think will be the biggest impact on healthcare beyond the front lines of the pandemic? This is a huge problem for healthcare right now. In areas like New York City and northern Italy, we've seen institutions that are unable to cope with the volume of patients. And don't forget about people with other diseases, pregnant women and kids who need routine vaccines. We are not prepared, and there will be a lasting impact. Eric. My daughters are due for their 12-month vaccinations, but I'm terrified of getting out with them, especially when I would have to take my 2 other children with me. My county is currently doing shelter in place. What would be your suggestion for situations like this? You should try to call your physician's office with that question. I find it unlikely that the doctors doing this are going to give personalized medical advice. What do you think of the low case count in a densely populated country like India? The low case count in a densely populated country may reflect a lack of testing for the virus, rather than a lack of infected people. Nancy. Does it work the other way too? Spikes in numbers means that more tests are being done. Those are usually noted in the numbers. For example, Quebec, Canada explained a jump in numbers when they allowed more labs to certify tests. Quebec also counts their tests differently. They report presumed cases and confirmed cases both as confirmed cases. Other provinces only report confirmed. Quebec is playing it safe and trying to make their numbers as large as possible, so people actually get worried. It worked on me. I freaked out seeing our numbers. Yeah, same. Then I found out how they changed their counting system. Some people are saying this is a way for legal to get more funding from the federal govt. It is up their alley, but it is fucking smartimo. And now, if you go outside you only see cop cars patrolling, and the odd grocery shopper. Their definitions doing their job well. Cops, homeless and joggers in my part of Montreal. Hi. It's me, a Montreal jogger. Good man. Stay healthy, wash your hands, you know the drill. Me too, stay safe. I started avoiding the paths and using the side streets because they are a little too crammed with people.